Good afternoon, everyone. I'm here to, first of all, I will say thank you for the effort you're making in the Duchenne. It is not about the competition. It is about bringing a good product to this patient. That's who need it the most. Thank you for your all efforts at the same time. With Fibrogen, we have a different molecule with a different approach for Duchenne muscular dystrophy. Again, we're starting as addressing the fibrosis. And at Fibrogen, we have a anti-CTGF, anti-connective tissue growth factor as to address the fibrosis. This molecule changed name, used to be called FG3019. Now we call it with even more difficult name than my last name. It's called Pamrevlumab. Pamrevlumab. So they make it difficult for everyone, including us. Pamrevlumab has been in or FG3019 has been in the clinical trial for a good period of time. So it's enrolled a lot of patients in different patient population with fibrotic diseases. It was studied in liver fibrosis, was studied in IPF, idiopathic pulmonary fibrosis, and is being studied currently at the same time in pancreatic cancer. So a total of 550 patients has enrolled and been tested with this product. Currently, we have in pulmonary fibrosis, we have a study is completing as we speak now. We expect to get the result by the end of July. In pancreatic cancer, we tested this molecule in 75 patients as a phase 1 study. And we have a follow-up study that will complete by the end of this year with another 42 patients. And the same mechanism idea is that these are diseases with fibrotic basis. So what's the rationale to use Pamrevlumab in Duchenne muscular dystrophy? So you heard from my previous colleagues about the role of the damage of the normal myocyte, the normal muscle fibers. And this damage is get accumulated in Duchenne muscular dystrophy. And we have tested in our product, as I said, this is an anti-CTGF. The idea came from the wound healing process. The wound healings is to start by an injury occur, and the wounds need to be a healing process. And this healing process is the fibroblast, the fibrotic processes get introduced. And to get the fibrotic process to move forward, a CTGF, it's a protein that is sitting outside the cell. Although it's called growth factor, is not truly the growth factor, is not a hormone, and gets elevated. In Duchenne muscular dystrophy, the CTGF is maintained high. Pamrevlumab is block CTGF and reduce the excess of CTGF. We have seen this in some of the models, the preclinical models that we have done. And we looked at the effect on the vessels and the muscles of the vessels. By introducing an anti-CTGF, we increase the flexibility of the muscles, of the vessels. Usually, a lot of diseases can cause the vessels, the vein and the arteries to become stiff. By introducing anti-CTGF, will bring more flexibility back to it. Anti-CTGF or CTGF could be found in too many organs. It's not limited to one tissue samples. So we decided to go for Duchenne in the mouse model called the MDX mouse model. And we tested that model, and we had from that model a very reasonable and good results. And on the basis of these results, we made the goal to start a clinical trial in Duchenne muscular dystrophy. The other basis of that moving forward in a pediatric patient, that we had a very good safety profiles, luckily similar to my colleagues, that they have a good safety profile in their molecule. So in our molecule, we have a very good safety profile in adult. And we were hoping that we will see the same safety profile in the Duchenne patients. So we started a clinical trial, which is called 079, in non-ambulatory, which is different than the patient population was discussed in the previous study, in the patients who are on wheelchair. This study started long ago, in my estimates. It started at the end of 2015 and was targeting to enroll 22 patients. And we have the design of the study that is still ongoing and enrolling. The enrollment of this study is stalled a lot for a long time. By the end of March of 2016, we were able to enroll only 3 patients. And from March 2016 till March 2017, we enrolled 0 patients. We could put every single effort. PPMD was very instrument in spreading the news about these trials, but was not very successful at that time. And suddenly in March of 2017, we feel very lucky that that shifted. And now I can proudly say that now we have 10 patients in this study in a period of 3 months. We added 7 patients. Our patient number 11 and 12 will be enrolled on July 5th and July 7th. So hopefully we will catch up in this study, and we continue to enroll. This study was planned to test the product for 1 year and to have a 6-month extension. But this study will be amended now with the advice of our key KOLs, and specifically Dr. Ann Conley, who suggested that we should afford this product to our patient for extended period of time. So the study will be for 2 years, not for 1 year. So what is the main endpoint of this study? Every study has to have one. And the difference between our study and the other studies been done, we are similar to Sarepta. Our study is totally open label. There is no placebo control in the study. And so we are able to see the data on time. The main endpoint is, first of all, the pulmonary functions, the forced vital capacity, the patient's ability to breathe, the changes in that capabilities. The muscle function test, the upper muscle function test. And at the same time, there is some other test, MRI, that's imaging of the biceps. And we will do imaging, we are doing imaging for the cardiac. We suspect that we will have an effect on the cardiac muscles at the same time. You can see here is a list of the inclusion criteria of the patient who could be this young men that we are hoping that they get enrolled and will get a result from this study. At minimum age of 12 years old, non-ambulatory, the Brooks score of -5 or more than 5, anything below -5, this is acceptable. Able to test the spirometry, so it's very important for that test. As you heard, that is one of our main endpoints, is forced vital capacity. A patient who would be willing to go under an MRI test. And the lists go on, and this are available. Even if you go on clinicaltrial.gov, you can see the full list of the inclusion criteria. Of course, every study will have an exclusion criteria. So that is where some of these patients will not be able to enroll in. If they require continuous ventilation, if they have an anticipated surgery to occur within 78 weeks, if they are requiring antiarrhythmic therapy, if they were hospitalized for respiratory failure for less than 6 months prior to enrollment, and controlled asthma, a specific weight limit. The reason for the specific weight limits, because this is an infusion product, and it will take several hours to complete each infusion. And this infusion occurs every 2 weeks. So the bigger the dose, the longer the infusion will occur. So the infusion could take from 1.5 hours to 2.5 hours. So the dosing is every 2 weeks of this product. And there is a multiple procedures that has occurred during this visit. And as been said before, a lot of our young men have to travel and drive for long distance to get to this limited site that are able to enroll these subjects. So we can do many tests at the same day. We provide some support to travel to the site, stay overnight, some of the support to travel to the site and cost of travel, as we can try to minimize the burden, as to empower these families to bring their children to this study. These are our key number of sites that's enrolling. In Cincinnati, in St. Louis, Missouri, UCSF in San Francisco, next door to our offices, Children's Hospital in Colorado, the University of Iowa in the Children's Hospital, and Children's Hospital in Philly, Boston Children's Hospital, Shriner in Portland, UCLA in LA, and Children's Medical Center in Dallas, Texas. These are our story for now. We will hope the next time we come back here, we can give you a data, how these subjects who are decided to enroll, have this family who brought in their children, these young men to be enrolled, how they're doing, and we hope that we can bring a positive news. We hope that the study would continue to enroll this similar to the last push in the last 3 months, and we can be able to complete enrollment within this year. So by the time we can come back next year, we have data that we can provide. Our sincere thanks to the whole community of the Duchenne muscular dystrophy. They are, in my mind, they are heroes. And I would like to thank all the advocacy group. This is another hero group that is support a very important cause. And I will say thank you to PPMD for inviting us. And we're hoping that this next time, our investigators, some of them will be with us in here to want to present this data to you. Thank you.